Welcome. Today we're diving into the world of nasal polyps, soft, painless growths that can develop in the lining of your nasal passages and sinuses. While often benign, these polyps can cause a range of uncomfortable symptoms and affect your quality of life. So, let's unravel the mysteries of nasal polyps and explore what you need to know. What exactly causes these nasal protrusions? The exact etiology is complex and not fully understood. However, chronic inflammation is believed to be the primary culprit. Conditions like chronic sinusitis, allergies, asthma, and even certain immune disorders such as cystic fibrosis and Churg-Strauss syndrome can lead to this persistent inflammation, creating a breeding ground for polyp formation. Some genetic factors might also predispose individuals to developing them. Let's explore the how and why. Nasal polyps aren't tumors or cancers, they are simply inflammatory tissue. Prolonged inflammation causes the lining of the nasal passages and sinuses, the mucosa, to swell. This swelling can lead to the development of fluid-filled sacs. Over time, these sacs can elongate and form the characteristic grape-like structures that we call nasal polyps. They're typically found where the sinuses open into the nasal cavity. Their growth obstructs the normal flow of mucus and air, leading to many of the symptoms we'll discuss. Nasal polyps are a fairly common condition, affecting an estimated 1 to 4% of the population. They tend to be more prevalent in adults than in children. Interestingly, men are also more likely to develop nasal polyps compared to women. While it can occur at any age, they're most frequently diagnosed in people over the age of 40. Now let's talk about how nasal polyps manifest. The symptoms can vary depending on the size and number of polyps. Common signs include a persistent stuffy or blocked nose, reduced or absent sense of smell, nasal congestion, postnasal drip, facial pain or pressure headache, and even snoring. In severe cases, large polyps can obstruct breathing and lead to sleep apnea. Some people may also experience frequent nosebleeds or a feeling of fullness in the ears. How are nasal polyps diagnosed? The diagnosis typically begins with a physical examination. A doctor can often visualize the polyps using a lighted instrument called an endoscope, which is inserted into the nasal passages. To get a more detailed view and rule out other conditions, imaging tests like a CT scan or MRI may be ordered. Allergy testing might also be performed to identify potential allergy triggers. While we don't traditionally classify nasal polyps into strict types, understanding the underlying cause can help guide treatment. For instance, some polyps are associated with allergic fungal sinusitis, while others might be related to aspirin-exacerbated respiratory disease, also known as Santer's triad. These associations influence the management approach. The goal of treatment is to reduce the size of the polyps and relieve symptoms. Initial treatment often involves nasal corticosteroid sprays or drops, which help reduce inflammation. In more severe cases, oral corticosteroids may be prescribed for a short period. Antihistamines or decongestants can help manage allergy symptoms and nasal congestion. For polyps that don't respond to medication, endoscopic sinus surgery might be necessary. This procedure involves removing the polyps and widening the sinus openings to improve drainage. While there's no guaranteed way to prevent nasal polyps, managing underlying conditions like allergies, asthma, and chronic sinusitis is crucial. Avoiding exposure to known allergens and irritants, such as smoke, dust, and pollution, can also help. Using a humidifier can keep the nasal passages moist, and practicing good hygiene, such as frequent hand washing, can minimize the risk of sinus infections. The prognosis for nasal polyps varies. While treatment can often provide significant symptom relief, polyps have a tendency to recur. Regular follow-up with your doctor is essential to monitor the condition and adjust treatment as needed. Recent research is focused on developing more targeted therapies to prevent polyp recurrence, including biologics that target specific inflammatory pathways. Ongoing studies are also exploring the role of the microbiome in nasal polyp development. These advances offer hope for more effective and long-lasting management of this challenging condition.